This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is Med Talk, your weekly on-air health consultation here on the Solar News Channel.
Our body's immune system is supposed to protect us from infection and sickness. But when one has an autoimmune disease, the very source of the body's protection is the one that attacks the body. An autoimmune disorder is a condition that occurs when the immune system mistakenly attacks and destroys healthy body tissue. There are more than 80 known types of autoimmune disorders, and one of them is lupus. Lupus is an autoimmune disorder that affects the joints and muscles, the skin, kidney, heart, lungs, nervous system, and the blood-forming organs and blood vessels. It is characterized by varying degrees of inflammation in any or all of these sites. The Luisa Project says that in the Philippines, there have been over 2,000 reported cases of lupus between 1997 to 2007. One of the most well-known lupus patients in the country was the deposed President Ferdinand Marcos. More recently added to the number of lupus cases in the country is Ms. Janet Lista. She's 27 years old and she's part of the research staff of a business development company. Before her symptoms appeared, she was living a very normal and active lifestyle.
Before ako ma-diagnose, nag-out of town ako nun eh. So, after nung out of town ko, doon naglabasan yung mga rashes ko.
Her first symptoms appeared in 2011.
Nagkaroon ako ng mouth sores, lymph nodes, pamamaga ng kamay or renodes, nagkukulay violet siya. Then, nagkaroon ako ng butterfly rash. Kinuha nila ako ng ANA or anti-nuclear antibody. So, dun sa result na yun, nag-positive ako dun. And then, meron din silang pinakuha sa akin na immunology na tinatawag. Meron dalawang test din na nag-positive din ako. Yun yung anti-SSB and anti-SSA.
Now, she has to take medication to manage her symptoms. But aside from the medicine and regular checkups, she's living a relatively normal life. An autoimmune disorder like lupus will certainly force a patient and even those around her to make a lot of changes in their habits and lifestyles. What causes these disorders? And how are they different from the regular diseases we know about? Are autoimmune disorders curable? Or are there methods we have today only for managing the symptoms? Find out more in this episode.
With us tonight is Dr. Sandra Navarra, Professor and Head of Rheumatology at the University of Santo Tomas. Dr. Christine Bernal is also joining us. She's the Head of Pediatric Rheumatology at the University of Santo Tomas and Cardinal Santos Medical Center. You can join tonight's discussion by calling our hotline, dropping us a line on Facebook, you can tweet us, and you can email us. Now let's start the discussion. Good evening, doctors. Welcome to the show.
Good evening, Angel. Good evening.
There's no better way to start the discussion than by asking, what is lupus? Dr. Navarra.
Lupus is an autoimmune disease, and being autoimmune, auto stands for self. So it is the immune system going against oneself, and that's the reason why we have antibodies versus self antigens, antibodies versus our red cells, antibodies versus the heart, the covering of the lungs, even the brain and the kidneys as well. And these antibodies and antigens in the self, there's self antigens and self antibodies. So they circulate in the body, and they can lodge in very vascular tissues like the kidneys and cause a lot of inflammation and eventually damage.
Wow. Dr. Bernal, why is there an attack that goes on inside our bodies, and why can't they differentiate between the antibodies or the antigens and the healthy tissues?
Well, the exact cause is unknown, unfortunately. But basically, the immune system, instead of protecting the body, is a bit confused. So instead of protection, it's more of attacking the self.
And as mentioned in the VTR, there are about 80 types of an autoimmune disease. But tonight, like as mentioned, we're talking about lupus, and not a lot of people are aware of the causes and the symptoms of lupus. Maybe we can enlighten everyone on this topic.
For one thing, because lupus is an immune complex disease. When you say immune complex, you have antigens, and these are self-antigens. You have antibodies versus the antigens, and they bind together and they go into the circulation. They reach out into several organs, and it can potentially affect the heart, the lining of the heart, the lining of the lungs, the brain, and the skin and the joints. So it can present with a lot of potential manifestations. That's why we call it a multi-system disease. And what we'd like to emphasize is that lupus is a highly individualized disease, and no two lupus patients are the same. There's a wide spectrum. You have patients who come in only with joint problems, maybe a little butterfly rash. At the other end of the spectrum, you have a patient who goes into bad kidney problems, and they will require dialysis. So that is the reason why when we treat and manage our patients with lupus, it's a very individualized approach to therapy.
You speak of treating and managing your patients with lupus. How is lupus diagnosed?
Well, the diagnosis of lupus is based on the clinical manifestations, like patients would come in with the typical rash or prolonged fever, and then they can have joint pains. But these clinical manifestations are combined with some tests, specific tests, that can confirm the diagnosis of lupus. So there was mentioned about the ANA or some specific immunoserologic tests which can help confirm the diagnosis of lupus.
Who is affected by lupus? Who can get affected by this disease?
Our local data among Filipinos conforms with the universal data worldwide, wherein you have the peak age of onset is usually about 28 years old, or 28 to 30 years old, about peak age of onset. But you can have patients who are affected in childhood or even in the elderly. Mostly women, maybe because of hormonal problems or hormonal issues. We exactly do not know why. But we do know that females are more likely affected, but we do get males as well who have lupus.
So we'll talk more about this, and we'll also get into those who are kids, pediatric care for those who have lupus. Before that, we'll go to our Twitter question, doctors. Missy Pasqua asks, is there any way to avoid getting lupus? Dr. Navarra.
Oh, avoid getting lupus is going to be rather difficult. The more important thing is that the reason why it is difficult to avoid or to know how to avoid lupus is because we do not know the cause. Remember, lupus is an autoimmune disease. We do not know the exact cause, what exactly triggers it. We do have studies that says that maybe you have infections that may trigger it. You have a patient who is likely to be genetically predisposed to lupus, but will not express the disease. They're okay, they won't need medications. But once you have a trigger, like you have an infection or stress factors or maybe smoking or viral infections, we do not know exactly what, but then now the lupus comes out and expresses itself, and the patient may need to see a doctor for this.
Thank you, doctor. From Robbie Palos via Facebook, why is lupus more common in people of color? And why are women more at risk? We were talking about this earlier, Dr. Bernal.
Yes, so there was mention about hormonal factors that can somehow predispose women to develop lupus, but again, males are not exempted to develop the disease as well.
Okay, I hope Dr. Bernal was able to answer that question. One more from Facebook, Nina Azores. Are the symptoms of lupus progressive? Would a lupus patient be in danger of developing other complications or diseases because of this?
Lupus is a disease in evolution, and it can present in many ways. Different patients can present differently. Complications are common, especially when you have very active lupus. And the reason for this is when the lupus is very active, and when I say very active, these are patients who present with complications in the kidneys, complications with swelling maybe of the lining of the heart, with fluid in the lining of the heart and the lining of the lungs, or they can present with convulsions because of involvement of the brain. Then what happens is that these are the patients who will require a lot of medications. And these medications are intended in general to suppress an overactive immune system. But in doing so, it's a double-edged sword, because you have medications which are intended to suppress an overactive immune system, but they can also suppress the normal immune system. So what complications can you get? Not only do you have complications of the disease, but you can also have complications because of the medications. So that is why management is rather specialized and tailored to individual patients.
And we've been talking about the patients, that it's individual per patient. Each patient who may have lupus may experience different symptoms, may be treated differently. How about the burden of someone who has lupus to society?
Okay.
Dr. Bernal or Dr. Ibarra?
One of the things that we need to remember and keep in mind is that when lupus, again, I would like to emphasize on this, is that lupus affects patients or people of a lot of potential productive age group, reproductive age group. Can you imagine, for example, a 28-year-old, 25-year-old, 30-year-old with lupus? These are the groups of people who are most commonly involved. Now, who are these? These are mothers, these are the teachers, these are the workers of society. And it is not just a burden in the family, not just a burden to the patient, but a burden to the caregivers, and also a burden to society. So these are patients, for example, who are supposed to teach, but they can't teach because they have lupus. These are the people who are supposed to go to work, but they can't report for work. So even the productivity is affected. And that becomes a burden not just of the patient, not just of the caregivers, but also of society in general.
So that's why it's very important to understand what lupus is all about, the care given to someone who has lupus. And for the individual who may have some symptoms, when does one need to go to their doctor? When they notice something, maybe a swelling of the joints, or maybe a discoloration in their skin, or maybe a different feeling that they've had, aside from the normal feeling that they have on a regular basis?
Well, typically, lupus patients would come in with the rash on the face, which we call butterfly rash, and prolonged fever, meaning on and off fever, is quite common among Filipino children, particularly with SLE, and mentioned about joint pains. Not only pain, but there's swelling, there's stiffness, so they have difficulty, particularly in the morning when they get up from bed. And aside from that, as mentioned by Dr. Navarra, it can affect the kidneys, the brain, so a lot of clinical manifestations. So any symptoms actually can be explained by lupus. So certainly they have to see their primary care provider first, and then if they're not getting better, always think of infection first. When children get fever, then that's the time then they get workup and then eventually confirmed to have lupus.
And then proceed to the prevention, possibly, or the treatment. And then as well as the guidance of those around them to be able to take care of them properly.
Yes.
Find out more about lupus and autoimmune diseases when we return.
Singer Toni Braxton was hospitalized due to lupus flare-up in 2012. Musician Seal was diagnosed with discoid lupus when he was a teenager, leaving him bald and with scar marks on his face. And singer, rapper, comedian Mariah Carey's better half, Nick Cannon, was diagnosed with lupus on January 2012.
We're back and still discussing lupus and autoimmune diseases. Doctors, does lupus progress?
Yes, it can, and in some people it can just stay as is. And the more important thing is that one will just need to, once diagnosed with lupus, you just need to learn more about the disease and be a partner in your care.
Okay. In learning more about the disease, you've written a book, Doctor. And it's right here. Maybe we can talk about this a little bit.
Okay. So well, it's Hope for the Butterflies. It's called Living Well with Lupus. It was written by one of our former fellows in rheumatology, and she now stays in Indonesia. But she's very dedicated to patients with lupus. And I co-authored this with her. And actually, this is a compilation of stories of patients with lupus. And through those stories, there's always hope. And that's why we call it Hope for the Butterflies. And it's intended to be a handbook for patients as well as their caregivers. You know, once diagnosed with lupus, sometimes in a patient who's first diagnosed with lupus, it seems like the whole world falls on her. And she needs the best support that you can get from family, from friends, and from the community, and especially from the doctors also. And doctors will also need to know how to care for patients with lupus. It doesn't have to be a rheumatologist, but the rheumatologist will partner also with other physicians, because there are different doctors may handle patients with lupus depending on the presentation of the patient. So this handbook can be especially for beginners, for patients or caregivers who are at a loss on how to cope with the illness. And we hope that this is going to be useful for them.
I'm sure it will prove to be very useful for the patient as well as for, like you mentioned, the caregivers. I was wondering if in that book you have young patients as early as maybe 5, 6, or
Oh,
7.
yes.
Yeah, actually there's one story there about a child with systemic lupus erythematosus. So, and as you know, kids can have lupus as well, so they're not spared. Commonly, they're in their teens, although my youngest lupus patient was diagnosed at 4 years of age, although
What
it's
were
not
the
that common.
symptoms, if you don't mind sharing, about your 4-year-old patient who was diagnosed with lupus?
Well, she presented with anemia and persistently low white count, low platelet count, and then eventually further workup revealed that those abnormalities were because of lupus.
Is she still able to play? Is she still able to go to school?
Well, yes. I can proudly say that my patients with lupus, they're all in their teens, they're all in school. So I try to convince them, to live as normal as possible, just like any other kids or teens without disease.
So in living normal lives, does it mean that lupus can be cured, or is it just controlled?
The only reason why we can't talk about cure is because nobody exactly knows what the cause is. So we talk about control. This is the safest way to do it. But control in the sense that no medications, and they live a normal life as they would live it, except that no sunlight, right?
Yes, certain restrictions.
Oh, there are certain restrictions.
Yes, certain restrictions. Live a normal life, but I would always tell my patients with certain restrictions. And Dr. Navarro mentioned about sun exposure. So we try to let them know that they should avoid excessive sun exposure, because it can affect the immune system and eventually can cause the disease to be active.
But how's that? Summer's approaching. How's that? How will they enjoy the beach? Can you wear sunblock, or maybe put a hat on, or other protective gear so that you can still enjoy the sun,
of course,
which is a source of vitamin D.
Yes. Yeah. Nobody likes too much sun anyway.
Yes.
It's not good for the skin.
Okay, so just a little bit of sun, the healthy sun, would also be good for them.
Yes, I would always tell my patients sun is their enemy, so sunblock should be their best friend.
That's a
So
good
they
tip.
should always have the sunblock in there.
For a good tip for everyone.
Yes.
Sun is our enemy, so sunblock should be our good friend.
Yeah.
And we have good friends who have dropped in a line on Facebook. Marco Martinez, my wife has lupus. I'm worried that this could affect our plans to have a family. Will she still be able to have children? Or would it be too taxing for her body to undergo pregnancy? He adds, will our child be in danger of having the same disease?
Pregnancy is possible in patients with lupus. Even once you're diagnosed with lupus, you can get pregnant. But the best is still have your pregnancy when your lupus is quiet.
What does that mean? What does it mean when your lupus
As a
is
general
quiet?
rule is, well, we say if your patient, or if the patient is not taking too much of steroids, like prednisone equivalent of 5 milligrams per day, that's a very low dose of steroid, very low immunosuppressive agents, then these are, or none at all. Or maybe just hydroxychloroquine. Hydroxychloroquine is something we give our patients with lupus, even if they're not active, and it's also to prevent flares of the disease. So once you're on that and your blood counts are all right, you don't feel anything, you're going about your usual daily activities, and you feel quite well. So that's lupus in quiescence. Stay on that in about 3 to 6 months, but maybe even longer, the better. Then we say, this is the right time to get pregnant.
So there's the right timing for that as well. Now let's say he also asked about his child having lupus, contracting it from the mom. As you say, there are factors that can affect or that can contribute to one having lupus, which is genetics. So will the child, does it follow that he will have lupus or that she will have lupus?
Well, lupus is not a hereditary disease. Even if the mom has lupus, it doesn't mean that the child will have lupus as well. In fact, the percentage of having a child of a mother with lupus is quite low. It's about less than 5%. But there's one type of lupus termed neonatal lupus, which is quite different from systemic lupus erythematosus. The main problem in neonatal lupus is that the mother has certain antibodies that have been passed on to the baby, and the main manifestation of that is more of a heart block, meaning it affects the heart. But certainly it's a different lupus. So,
okay. The genetics still do play a role, but it's not the main factor for having lupus. Right now, we do have our cohort of patients wherein we look at the positive anti-nuclear antibody in relatives of, or first-degree relatives of patients with diagnosed lupus, and they don't feel anything. So we get their blood, they still turn out to be more likely to be positive for the test than in the normal population who do not have a family history of lupus. So genetics can play a role, and we're following up all these patients, or all these individuals rather, who have a family history of lupus and are positive for ANA but nothing else. And we're now following them up through the years and just finding out if they're going to develop clinical lupus or not. So that's part of the advocacy that we're having and research among Filipinos with lupus. Because we need to know whether our kind of lupus is different from lupus everywhere else.
Now, doctors, we have someone who dropped in a line on Facebook who has lupus. Her name is Sheena Astores, and she says, I am a lupus patient, and I know how hard it is to have such a condition. It's not only hard for me, but for my loved ones as well. Are there any support groups that I can go to and my family can go to as well? Doctor, we mentioned about the book.
Yeah.
That's one form of support. That's one form of help. Any other groups?
Yes, of course. When you Google or look at the websites, you find a lot of websites that are on lupus. We do have our website on luisaproject.org. We have lupus clinics. We have, when we say lupus clinics, that's where we have our patients coming to clinics. And at the same time, patients who don't come for a checkup but are just there to just tell their stories to each other and share their stories on how they cope with the illness. So we do have schedules for that, and that we can provide that. It's usually 2 or 3 times a month that we hold regular clinics.
And you mentioned the luisaproject.org. Is that a website that they can visit?
Yes, it's luisaproject.org.
Okay. Doctor, I'd like to go back a little bit to, we were talking about someone with lupus getting pregnant and then not necessarily passing on the disease to the child. Does one have to undergo newborn screening? Is it part of newborn screening nowadays to have one tested with lupus if the mother does have the disease?
No, SLE is not part of the newborn screening.
So it's a separate medical test?
Yes, we have a different test to confirm whether a child has SLE or not.
So doctors, yes, please.
Well, yeah, we need to emphasize that the diagnosis, as Christine was saying, the diagnosis of lupus is not by tests. The diagnosis of lupus is looking at the patient, asking for the history, getting the history, and doing physical examination. And doing basic tests. We don't even go at once to the anti-nuclear antibody. That's a little expensive. So very important is that you suspect the illness. Maybe you have a family history, or maybe you have a rash, or maybe somebody's losing hair. Those are some of the manifestations, or somebody just feels unwell with fever. They're diagnosed with something else, given medications for that infection. They don't get well, and eventually these manifestations just evolve over time. So that's how enigmatic and challenging lupus can be. And it's maybe towards the end when they have more full-blown manifestations that we get to do more specific tests like their anti-nuclear antibody. So it's an illness in evolution.
Wow. And do you catch it early on? Is there a way to catch it early on aside from what you've mentioned, Dr. Bernal?
Well, it's easy when they present with a typical rash or they have joint pains. But sometimes there are some patients who may present differently. And it may take a while before the diagnosis, can be given to that patient.
So any tips, Dr. Navarra, let's start with you. Any tips for those who may be manifesting or suffering the symptoms that you have mentioned? How do they go about going to their doctor and explaining how they feel?
We have a program, again, thanks to the Louisa Project. We have programs now, educational programs for patients and educational programs also for doctors, not necessarily just rheumatologists. And slowly, even on the undergraduate level, we are now exposing them to lupus. So they're able now to hopefully recognize the manifestations early and monitor these patients or watch closely the manifestations. As I said, it is an illness in evolution. So then when you have the suspicion, then refer now to the specialist. So that's important. Now for those who are already diagnosed with lupus, it's important also to learn as much as you can about the illness, because you are the best person to help your doctor, and when I say you partner with your doctor in the management of the disease. An educated patient is one of the best management situation that we can have in the clinic. So we can discuss with the educated patient, and not just the patient but also the caregivers.
Thank you very much, Dr. Navarra. Any last message, Dr. Bernal?
Well, one is that kids can have lupus as well. That's why I'm here, okay? Just to let everybody know that it's not only a disease of the adults. And of course, we want to have early recognition, because just like in any other disease, if you recognize them early, treat them right, then they can have a better outcome.
Thank you very much. A better outcome, definitely, a better quality of life. Thank you very much, doctors.
Thank you.
Thank you again to Dr. Sandra Navarra and Dr. Christine Bernal for helping us understand more about lupus. See you again next Tuesday at 10 p.m. for your on-air scheduled health consultation here on the Solar News channel. Next week, we kick off Women's Month by understanding more about menopause, dysmenorrhea, myoma, and hysterectomy. So send in your questions via Facebook, Twitter, email, or call us. This is Angel Jacob for MedTalk. Thank you and good night.